Hey guys, Tony Maritato here, licensed physical therapist, and in this video I wanted to answer some of the common questions around why do you have shin pain, pain around the bottom, top of the knee, the outside of the knee, the inside of the knee, and this particular pain, like there's lots of different kinds of pain. This pain that we're talking about today is a bone pain. Why does my bone hurt? Why does my shin hurt? So behind me on the screen, you can see there's a bunch of x-rays, a bunch of images. Let's talk about a couple of things. The first one here. So patients will often talk about pain or this, like it feels like a thick band just compressing the top of their shin bone. It runs around the front, it's really tight, it's really compressed, it's painful. Let's talk about what might be causing that. Certainly pain and swelling. Certainly if you just feel the skin on your thigh, and then feel the skin right below the joint line of the knee, the tibia, this section right here on the x-ray, you can see it. The skin is super tight. So there's going to be tightness in the connective tissue, there's going to be tightness in the skin, tightness all around that. There's an implant in there that's taking up more space than the original knee used to take, plus the tissue was sewn back together. So some of that tightness is going to be pulling on the bone. But another important component, if you look at this x-ray on the screen, you can see that the femur, the upper thigh bone, and the tibia aren't exactly straight and lined up. And most patients that I see within the first couple weeks after therapy or after surgery, while I see them in therapy, they're not at full extension. So just imagine even 3 degrees, 5 degrees shy of full extension. That femur, the bone on top, is at an angle relative to the tibia. So when you're standing, that femur is pushing down and forward, which is creating a lot of force right there at what we call the tibial plateau, where the patella tendon comes down and attaches. Plus you have this implant, this little post right here. Some are bigger, some are smaller. But that is going to create an anterior shear force. That is pressing forward against the outside of the tibia from the inside. All of these factors are going to come together to create that kind of bone sensitivity, that bone soreness. Now, as your extension improves, as your range of motion gets from 5 degrees shy of full extension to 0, that shear force is going to be reduced. That anterior pressure on the top of the shin will improve. Plus, your bone is going to get desensitized. Your bone will get used to that pressure and not be as sensitive anymore. That bone sensitivity doesn't just happen front to back. It also happens side to side. So if we take a look at another picture, this is a picture from a website. I'm going to zoom in on this picture right here. And what we can see, so this is a common scenario. This is a before and after photo of somebody who's had a total knee replacement. And you can see here that in picture A, there's no space between the bones of the femur and the tibia, whereas in picture B, the space is normalized. Think about this for a second. Think about the amount of compressive forces the patient is experiencing on the inside of that knee before surgery. Okay, so that may be a component of why the pain was so intense. The grinding in the knee might have been going on. But also think about if the inside of the knee is being compressed, the outside of the knee out here is being decompressed. There's not a lot of pressure going on. That bone is not used to a lot of force because all of the force is transferred to the inside of the knee. Now fast forward, you have a brand new knee in there, everything is lined up, the knee is nice and beautifully straight. Well, all of a sudden we went from like 70% compression on the inside, 30% compression on the outside to 50-50% compression. Now it's completely reasonable for the bone on the outside of the knee in this case to experience significantly higher compressive loads and have to adapt. And just like anything, if it's snowing right now, if I go outside without gloves and I start shoveling for 30 minutes, I'm going to develop a blister because I didn't give the skin on my hand enough time to adapt to the new stress. But if I was to do a little bit of shoveling or a little bit of raking, and every single day I do more and more and more over time, I'm not going to get a blister. I'm going to get a callus because it gives my skin time to adapt. Your bone is no different. All living tissue in our body will adapt as long as we provide slow and steady stimulus to it. So when somebody comes in and they have significant pain on the inside of the knee or the outside of the knee, one of my common questions is, well, before surgery, were you bow-legged or were you knock-kneed? Were you valgus or varus? Because that absolutely can have an influence on where the new stress is through the knee. Plus, you have to look at now after surgery, especially once you get past the first 2 weeks, you're spending a whole lot of time doing new exercises, walking differently, moving differently. Potentially, you have a new pair of shoes. All of these different things are going to cause new stresses through the tissue. The muscle, the bone, the nerves that surround the knee, the vascular system, all of it is going to be worked in new ways. You're going to go through an adaptation period. So generally speaking, all of these new sources of pain, they're typically different than the pain you had before surgery, but they're pretty normal sources of pain. So I wanted to give you guys this little video to give you a chance to say, oh, okay, you know, that makes sense. Maybe we hadn't talked about that in therapy. So a knee that's bowed out, once it's straight, you're going to have new compressive forces on the inside. If you don't have full knee extension, you're not standing right over the knee, it's normal to have anterior shin pain. All of this stuff is within what we would expect. What's important for you is that you understand this is normal, this will get better, and talk to your therapist, talk to your surgeon. See if there are strategies, see if there are things. Like, you guys know I'm a huge fan of the rolling pin massage. I'm a huge fan of any kind of modality that might help reduce pain, at least temporarily, until you can get on your feet and do the things that you want to do. The reason you had the knee replacement is to go out and enjoy life. And that's my goal for you, that's your therapist's goal for you, and definitely that's your surgeon's goal. So guys, thank you so much again. I hope you get out and enjoy this weekend. And if you have questions, post them in the YouTube comments below, because your questions provide me with more material and ideas for new videos. I'll catch you guys later.